isn't too bad. It's okay.
Okay, good morning, good afternoon, good evening, everyone. Thank you so much for joining us. We were just giving, say, 1 minute. As I can see, the numbers of people joining are increasing. So just 1 minute to allow those who are coming in to join us. Great. So good morning again, good evening, good afternoon, just depending on where you are. Thank you for joining us in this session today. We acknowledge that people are joining, but I think we need to start just because we have a very short session today. My name is Lina Digolo from the Safe Futures Hub, and I'm delighted to welcome you to this webinar, the first webinar, first of 7 in our Building Safe Futures deep dive into what works to end violence against children webinar series. We're excited to have you join this first session that brings together practitioners, researchers, and policymakers to explore what really works to end and to prevent and respond to child sexual violence. And today's session, we really focus on one strategy, the first strategy for us, which was a really exciting one, close to most of our hearts, those who've joined here, which is parenting and caregiver support. This is a vital strategy for protecting children from harm and building safer and more nurturing family environments. So I'm pleased to introduce first my co-moderator, Isang Awa, who's also a very good friend. I'm so excited to at last share the stage with her, and we promise you an exciting session. Isang is the head of advocacy from the Global Parenting Initiative based at University of Oxford. Isang, you want to say hi?
Sure. Thank you so much, everyone. And thank you, my dear friend Lina, for the warm introduction.
I don't know. We can't hear you, Isang.
Wow.
You can hear her? Oh, okay. I can't hear you. There's something happening there. But if everyone else can, that's fine.
Oh,
and again,
thank you so much.
just to remind us, I know you've seen this, but this webinar is co-hosted by the Safe Futures Hub, Parenting for Lifelong Health, and GPI, which are three initiatives that are really committed to this work ending childhood sexual violence. To start us off, next slide. I'd really like to introduce Safe Futures Hub. For those who don't know us, I'm sure a few of you have heard of it, but this is really, I think before I do that, let me just quickly run you through the agenda of the day. And this session will be very brief, 60 minutes. And we've lined up a very interesting set of panelists, quite experienced. We'll begin with listening to the evidence with an evidence spotlight, which will have 3 superb presenters who you'll meet very soon. After that, we'll have presentations. I'll hand over to Isang, who will do a very interesting panel discussion, and she'll also lead the Q&A. Post the Q&A, we will wrap up with a short reflection and just how you can connect with us and stay in touch for the future webinars. Please feel free to use the chat box anytime during this session. Tell us where you're joining from right now, who you are, where you're joining from, and also any questions that you have through the session, please post them in there and we will try our best to respond. We have a last session at the end very dedicated to this for you. So that's really what we've planned for the next 60 minutes. So next slide, briefly, around about Safe Futures Hub. Safe Futures is a global initiative. I think we are now 2 years old or almost there. That was launched at the Clinton Global Initiative annual meeting in September of 2023. It's co-led by 3 organizations, the Sexual Violence Research Initiative, better known as SVRI, Together for Girls, and We Protect Global Alliance. Our work focuses on 3 pillars, which is redefining knowledge, mobilizing knowledge, and building knowledge. And through these pillars, we really work to bridge the gap between evidence, practice, and policy. Our focus is really to elevate underrepresented voices, particularly those of practitioners and survivors, and to promote both research and practice-based knowledge to drive action. So you'll be seeing a lot of this incorporated throughout the webinar series. Our approach is collaborative and system-oriented, and we really aim to support governments, civil society, and the global partners at large working in this space to share learning and strengthen global movement towards ending childhood sexual violence. Next slide. So I'll quickly take us through to the next session. I'll introduce our speakers, and let's begin with evidence, the fun part. First, you'll hear from Nicholas, who is our director at Safe Futures Hub, and he'll share the highlights from Building Safe Futures Evidence Review. We launched this last year, the SVRI. This will really be focused today on summarizing the evidence around the parenting program, what we know, what we're still learning, and what we put together for you in terms of how parenting programs can prevent child sexual violence. Nicholas will then turn it over to Professor Jamie Lackman, who's the CEO of Parenting for Lifelong Health, and Professor Lucy Kluver, who's a professor of child and family social work at the University of Oxford. These two have done a lot of work extensive work around designing, testing, and scaling parenting program, and they'll today share these insights with a particular focus on how this particular program or platform can be used to end child sexual violence. So over to you, Nicholas, before turning it over to Jamie and Lucy.
Great. Thank you so much, Lena. It's great to be with all of you today. I have limited time to unpack related evidence from the Safe Futures Hub evidence review that we published last year, as Lena already mentioned, and focusing specifically on the Inspire strategy for parent and caregiver support. But really at the core of our work at the Safe Futures Hub is this idea of mobilizing diverse forms of knowledge to end childhood sexual violence. And this review squarely fits within that approach. And as you see on the next slide, we took a very consultative approach to creating and publishing this review, sharing it widely with the field, and really building it out with diverse insights in mind. And I'm not going to go through all the bullet points here since I don't have enough time. On this slide, you can see the distribution of evidence and studies across the Inspire framework, and not surprisingly, we saw a lot under parenting and caregiver support, and that's what we'll be focusing on today. And the next slide, just very quickly, shows you the map, just highlighting the study locations, and again, showing the diverse range of context we looked at and considered in creating this review. But a key takeaway for us in doing this review is that parenting and caregivers are really at the front line of prevention. We know that most sexual violence against children happens within families or trusted relationships. So that means the micro interactions, the conversations, the trust, and the boundaries, those make a huge difference. And in most studies, when families talk openly about safety and children feel heard, they are more likely to speak up, seek help, and be believed when abuse is actually disclosed. So what do parenting programs usually include? 3 things came up again and again in the evidence, and this is a very kind of quick synthesis of a larger body of work. So forgive me for being very succinct, but we saw a lot of group-based skills building for respectful relationships, safe communication, positive discipline, and recognizing sexual violence. Second, sorry. Oh no, what's okay? I think you can see me now. Okay, second, the support groups for parents so they can talk honestly about challenges and receive psychosocial support as needed. And of course, connections to services through health and social programs, and sometimes through home visits as well. And all the 3 create protective pathways, increased supervision and awareness, stronger child self-confidence, and better communication and disclosure. On the next slide, across the studies that we reviewed, we found 3 intervention categories. The first one was skills building programs for preschool children and their parents, which we considered effective when implemented with fidelity. Then we saw skill building programs for parents of adolescents and pre-adolescents, also effective and sometimes technology assisted. And you will hear about that from Jamie and Lucy later on. And then we also saw some parent counseling approaches that I already mentioned that also show a lot of promise in improving parenting practices, but we simply need more evidence to make it an effective approach. And if you're curious about evidence classifications, the effective, promising, prudent, etc., the full review goes into this methodology in greater detail, and we encourage you to look at it. And just to be clear up front, the examples that I'll be sharing on the next slides are purely illustrative, and there is more in the full evidence review. And again, just look at the full document if you want to learn more. So let's start with early childhood. I'm going to do this through the way of examples from the review and looking at the intervention from Turkey, for example, where parents participated in a 2-hour session using visual stories and tools on CSV, risks and protective measures. And then they practiced the lessons with their children at home. Even with such light touch, children showed better understanding of body boundaries and what to do if they felt unsafe or suspected sexual abuse. And caregivers also grew more confident in talking about sexual abuse prevention. And again, there are several interventions like this in the review, and I'm just trying to ground this into very specific examples, and this one comes to us from Turkey. And then, as kids reach adolescence, we know that the context also changes. Risks shift to online spaces, peers, and the broader community. And the great example is the DREAMS program coming out of Kenya, for example, that shows the power of layering supports. So combining education, mentorship, GBV prevention, and also parental engagement. And when families matter, which is a parenting component, was layered in, proportion of girls reporting no sexual violence in the last year increased from 79 to 100%. And you can see other stats on the slide as well. And again, DREAMS is just one example coming out of the evidence review. We also see promising parent counseling approaches. These create supportive spaces with trained and skilled facilitators where parents can talk about warning signs, share concerns, and practice communication with children. We saw improvements in awareness, self-efficacy, and protective behavior that was sustained over time. And the key takeaway here is that we simply need more measurement of direct impacts on child sexual violence to strengthen the evidence base in this area. And that's why we are classifying it as a promising approach. One important note here is that in the review, you'll notice that very few studies measured direct child sexual violence outcomes. And that is intentional and often ethically necessary, often avoiding putting children at risk just to measure victimization. So studies often, track proxy indicators like knowledge, communication, and disclosure, which we know are also key safety pathways. As with everything in our work, there are, of course, many limitations, small sample sizes, short follow-up time, and contexts where these conversations about sexuality may be very sensitive. But overall, one of the strongest insights across all evidence is that programs work best when they strengthen parent-child communication and when parents and children learn together. So what does this mean for our collective work? What we found in the review is that parenting support isn't an add-on, it's absolutely foundational in how we approach preventing childhood sexual violence. And when caregivers are equipped and supported and confident, children are safer in the long term. And just to wrap up, the examples I shared today are just snapshots. Please read the full review. And also, if you go to our website, there's a solution index where we unpack individual interventions, looking at how they work, why they work, but also what are the opportunities and challenges for scaling them up. Thank you so much for your time. I'm happy to take questions during the Q&A, and I'll turn it over to Jamie and Lucy now. Thank you.
Thank you very much,
so
Nicholas.
Yeah.
Just as the slides are getting up, it's just really great to see the comprehensiveness of the evidence review and the encouraging evidence that's coming out of many different areas around the world, demonstrating the importance of supporting parents as the frontline people on the front line of preventing child sexual violence. I think, Lucy, you are going to kick us off.
Absolutely. Wonderful. Should we go forward to our slides? That would be fabulous. Thank you. Lovely. And is it possible to make it full screen? Great. We're just driving through. Well, we'll start by, as we go, brilliant. And this is it. Wonderful. We'll start by saying this is a big question. Even a few years ago, we had no idea whether parenting programs could prevent childhood sexual violence. We saw them as quite different to the programs which were much more specifically focused on sexual violence prevention. If you go to the next slide, we have, however, made an incredible progress. Aruna, if you could go to the next slide, it would be lovely. And one back. And one back from there. Thank you so much. We've made incredible progress because in 2019, Together for Girls did a massive review of evidence of what can prevent sexual violence against children and found no programs that had been tested really robustly, as Nicholas was saying, in randomized control trials with long-term follow-up and with evidence of impact directly on sexual violence prevention. If we looked forward to the groundbreaking Safe Futures Hub review, which came out just last year, what we see is that we've moved forward massively. And if you go to the, it's just amazing to see. And for those of us who've been in the field, you know, it's just wonderful. But we're also thinking about all of this within a new framework. We've also had breakthroughs in how we conceptualize it. And this has been a framework developed by the Brave movement and others, but bringing forward this idea of prevention, healing, and justice as the three-part way that we're seeing our response to sexual violence in childhood. If you go to the next slide, we really tried to think then about how could we conceptualize the development of a parenting program and integrate into it content that would enhance its capacity to prevent sexual violence amongst children. And so some of these things and some of these pathways, and these were hypothesized pathways of prevention, some of these pathways along the middle are already existing within parenting programs. Improvement of things like involved parenting and parental communication. Increasingly, parenting programs think about equitable gender norms, for example, and thinking about improving children and parents' mental health. But we also had to think really clearly about whether there could be added components that would strengthen and boost that impact directly into childhood sexual violence prevention. So, for example, that parent-child communication also needed to be directly about the risk and preventative measures for childhood sexual violence. We also went through the evidence review, and Safe Futures Hub colleagues were a crucial part of this, to understand what could we incorporate that was highly evidence-based. And so we incorporated content from No Means No, a highly evidence-based program in the Safe Futures Hub review. We incorporated content from HIV prevention programming within DREAMS, so Tonya Thurman's projects in South Africa, and also content from Together for Girls, their guidance on bodily integrity and empowerment. So this was the idea. Could this work? Could we build a parenting program that also had these impacts? You go to the next slide, Jamie's going to talk about the next step of challenging innovation in this.
So, I mean, if we just take a step back and remember the extensiveness of this problem, where 1 out of 5 girls and 1 out of 7 boys will experience some form of child sexual violence in their childhood, we can't just think about how do we design interventions that reach hundreds or thousands, but really we need to be thinking about hundreds of thousands or even millions to be able to have the impact that we really want to see and the changes and driving that change on a global level. And so with colleagues in all throughout sub-Saharan Africa, and specifically in South Africa and Tanzania, we worked on developing a cost-efficient approach to addressing child sexual abuse that combined technology in an accessible way for low-tech environments. And that originally we were thinking, well, this would work as a digital-only intervention because then you could reach everybody. But what we learned quickly is to get engagement in these really difficult behavior change mechanisms that Lucy was talking about on the previous slide. You need a human level of engagement. And to make sure that people can engage in digital technology, you need to address some of the challenges and barriers to that. So in the design of the Parent app for teens that we worked on with and for families in Africa, it includes an in-person onboarding that helps overcome some of those challenges of getting involved in a new technology or learning how to negotiate through daily daily parenting modules, which are delivered through the app. And there's all these other bells and whistles that encourage engagement, like badges and surveys and quizzes. But a real crucial element was to also include weekly facilitated WhatsApp support groups. And those are facilitated by community facilitators, not professionals, but those who do get some training on how to help parents troubleshoot some of the challenges that they experience during the daily and weekly modules. And what is critical in this learning was that we found that the attendance rates and completion rates of the courses went from below 25% to over 85, almost 95% in some of the modules. And this is really critical to understand that if we're going to have an impact that is scalable, it has to still have a human element, but it has to be cost efficient. And so here we were able to develop a program that is less than $6 per family that includes the time needed to deliver the program. Next slide.
And so we thought we've really got to test this properly. And I'm sorry that some of the formatting seems to have gone a little funny, but we did a large-scale randomized control trial with close colleagues, the National Institute for Medical Research, led by Joyce, who's going to be on the panel, and ICS in Mwanza, Tanzania. This was with around 5,000 children and caregivers. And the crucial thing is that we used a cluster randomized trial process with testing for sexual violence impacts at 14 months after the end of the program. So over a year after the end of the program. We go to the next slide. We're just going to quickly show you some of the results of that. What we found was substantial impact on sexual violence victimization. This was girls' self-reported experiences of contact sexual violence. Over the past year, we saw a 67% reduction in the parent app group compared to the control group, who actually received a different intervention focused around water sanitation and hygiene. If we looked at past month sexual victimization, that was around 58% reduction. We did not see an impact for boys. And Joyce will be able to talk a bit about why we think that is, although there were obviously much lower rates amongst boys. If you go to the next slide, what we see is that we asked all sorts of different kinds of interventions to understand. So we asked about sexual violence vulnerability. This was a locally developed scale, which was about the things that put children at real risk. So for example, staying out late at night and catching lifts home with local motorbike drivers, situations where children are especially vulnerable. And we saw reductions for boys and girls. Crucially, we also saw reductions in intimate partner violence experience amongst the caregivers of those adolescents, not something we'd necessarily expected. You go to the next slide. We also looked at sexual exploitation, and it's a key challenge in this area, particularly where you've got high HIV incidence rates amongst adolescents. And what we saw in this was that we also saw substantial reductions, around a 50% reduction for girls over the last year in the parent app group compared to the control intervention. So if we think then, if you go to the next slide, about how did this work, we're still trying to unpack these pathways because we've only just had these brand new results. But what we are seeing is that an app, to our great surprise, was actually able to impact across all of these pathways, with the exception of consistent discipline, which we got worse at. So everyone got worse at consistent discipline. Parent report, adolescent report, by everyone. But with every other one of these pathways, we saw an improvement. And so now one of the things that we really have to understand is how was this working and how can we strengthen it? And again, Joyce has done some intensive qualitative work that I think will help us a lot. If you go to the next slide, it's over to Jamie.
So it's one thing to have evidence of have a program that is cost efficient. It's another one to have evidence of its impact. But unless it's integrated into existing service delivery systems, it will sit on the shelf and be a nice academic paper, and we'll never see any real scaling of child sexual abuse prevention work through supporting parents. But what's really positive, and this is something that Isang Awa has been leading on from the Global Parenting Initiative and Parenting for Lifelong Health, is the engagement of national governments and making sure that they follow through on their commitments that they made in the Global Ministerial Conference to End Violence Against Children to scale parenting support. And here are some examples of some national governments that are requesting the scale up of Parent App as a potential solution. Next slide. And to understand why this is so important is we know that the amount of funding that is available in development aid has shrunk considerably, dramatically, and many of us in this call have been affected by that personally, but also professionally. And so we need to be smarter with how we can work with less. And here you can see the difference in reach that you could attain from an investment of $1.2 million based on modeling that we've done in Tanzania, where an in-person group with all the different infrastructure costs of venues and delivery and transportation, normally it costs around $120. But we're looking at, if you go down to the blended in-person digital approach, that is the Parent App right now, that is at $6, and that is 20 times less. And so you can reach 20 times more people. And what we are also working with colleagues in South Africa is to also understand how can even a digital only approach have an impact on much wider levels of engagement. And if we go to the next slide, we'll see how we've been working with colleagues in UNICEF to develop a global framework, conceptual framework on how program delivery can be part of a system of care with a stepped care model in which you can deliver universal support at population level. Those who need extra support, who don't respond to that, can have that more targeted support like the app, the Parent App for Teens. And those who don't respond to that, who need that intensive care and response and the survival care, can get that more intensive multidimensional support. And it's together learning about how these different levels of intervention work together in a system of delivery that can be sustained is really where the future of the research that we're doing at the Global Parenting Initiative and at Oxford and the University of Cape Town, but also with Parenting for Lifelong Health in collaboration with governments. Next slide.
And we have more to do, and there are more challenges. As we've been working on this, rates of smartphone access in our region of Africa have shot up, leading to 80% in the next 5 years. And so one of the challenges is thinking about how do we integrate the prevention of online sexual violence within this, and how do we do that effectively? And we're working with amazing colleagues to try to do that. But I think there's also big next steps. We have to think about how can we use these kinds of concepts to strengthen multiple types of parenting programs around the world? How can we access and reach as many parents as possible? And how can we make it easy for them to engage and protect their children, which the Safe Futures Hub review has shown they really do want to do. So the next slide, just a thank you to an incredible set of partners. And the last slide to say some publications, ongoing publications. We haven't yet published the main trial results because we're just finished analyzing them. But if you want to have a look, and we'd always welcome advice, critique, and ways to improve. A huge thanks, colleagues. And it's just so lovely to see 92 people caring about this and joining this webinar. Thanks all for being here.
Thank you very much.
Thank you so much, Jamie, Lucy, and Nicholas, for setting the pace and sharing the evidence. I'll turn it over to Isang for an interesting session with the panelists.
Thank you. Thank you so much. And I'm really honored to be moderating this panel discussion. We have been joined by 3 inspiring program implementers who will share how their work connects parenting and the prevention of child sexual violence in practice. They'll also share what they are learning, what is working, and what still needs to be strengthened. And I'm delighted to introduce our 3 panelists. In no particular order, we have Dr. Sangeeta Saxena, a gynecologist, author, and activist. We also have Dr. Joyce Wamoyi, a social and behavioral researcher with over 20 years of research experience in adolescent and young people's sexual and reproductive health. And we have Beatrice Ogutu, a visionary leader with 20 years of experience driving transformative change across Africa. To read more about them, I think their profiles will be shared, if they haven't been shared already, in the chat. So I'm going to keep it brief because we're not doing to save us time. So welcome, Sangeeta, Joyce, and Beatrice. We're absolutely thrilled to have you with us. Let's dive straight into the conversation. So the first question to start us off, could each of you briefly introduce your program and share how, if at all, it addresses child sexual violence? We would also like to know whether that focus was built in from the start or emerged over time. And Sangeeta, perhaps we could start with you.
Thank you. So I'm a gynecologist and I began Enfold Proactive Health Trust 24 years ago in 2001. And we began with prevention of child sexual abuse. We went directly into schools and we still continue to go directly into schools, talking with children, adolescents, all the way in the school, then college and onwards. We have parenting sessions. We have sessions for teachers. We also wrote books, the workbooks that run in schools. They were published by Macmillan Private Limited, but their reach was limited. But currently, we are working with the government of Karnataka to include prevention of child sexual abuse and other related life skills in the textbooks by Karnataka government. We also have materials for children with disabilities, especially children with intellectual disabilities. So we have created a Suvidha kit for that. And that has been there going on since 2017. So that's in brief the kind of work. We also support children who have faced abuse and onwards.
Thank you so much, Sangeeta. That's a really helpful overview, especially how the work evolved to explicitly address child sexual violence. And Joyce, could you tell us a bit about your program, how it addresses child sexual violence, and how this focus on prevention came into your work?
Yeah, so thanks very much for inviting me to be part of the panel. So my program is the one actually that Lucy has shared those really exciting results from, but it's an innovative blended digital parenting program that aims to prevent violence, sexual exploitation, physical and verbal abuse among adolescents aged 10 to 17 years. And and so it targets caregivers who are 18 years and above. It comprises of about 14 modules that are delivered between parent and caregiver, parent leading, and of course the adolescent being part of those sessions. And our key objective, of course, I've said, is to reduce violence. When we started off with our 12 modules that were part of the trial that we've shared the results from, we had sort of a general focus on sexual violence prevention. But as we continued engaging with the caregivers, there was actually a request on more information on how they could actually prevent abuse among the adolescents, because as you know, this is a group that is also already maturing, reaching puberty and entering into sexual relationships. So they really wanted explicit content on that. So we strengthened our sexual violence prevention content by incorporating in programs for example, self-defense and empowerment that Lucy has pointed to, from No Means No Worldwide, as well as sessions on bodily integrity that came up as a result of requests from the caregivers themselves. We also had more content now that were focusing on safe relationships that were actually adopted as well from Brave Movement. So as we continued delivering these programs that had multiple sessions like the ones that were shared in the presentation that my colleagues have done, it became very apparent that when you're doing a parenting program that focuses on teens, clearly you have to have a focus on sexual violence prevention. So we strengthened ours even more the more we continued delivering it. And it was more now even on request, which made it even more relevant to the setting.
Amazing. Thank you so much, Joyce. It's so valuable to hear how research insights are shaping the content and program delivery in this space. And Beatrice, over to you. How has ICS approached this issue through its parenting and family strengthening work? Also, was the focus on child sexual violence built in from the start, or did it emerge over time?
Thank you so much, Isang, and I'm deeply honored to be here today to be part of this important conversation. And indeed, from 2012, as ICS, we've been implementing a skillful parenting program that was originally designed to address child maltreatment and positive child development. This program has evolved
I
since
think we have a
2012
little
to
bit.
now. Over time, we've been able to adapt to child sexual violence. Sorry?
No,
Can you
I
hear
think
me?
we had a little bit of problem with your volume. Or was that just from my end?
No, I think Beatrice, it might help if you switch off your video,
Can you
then
hear
we
me now?
get your
Yes.
audio properly.
I was going to suggest that. So if
Sorry?
it's okay with you, yes, better, please. Yeah. And feel
Okay.
free to go ahead,
Thank
please.
you so much,
you.
and apologies for that. Can you confirm you can hear me now?
Perfectly. Please go ahead. Thank you. And no need to
Great.
apologize.
Thank you again for the opportunity. I'm honored to be part of this important conversation around, the role of parenting programs in addressing child sexual violence. As investing in children and their societies, our Skillful Parenting program was originally designed in 2012 with the aim of addressing child maltreatment and promoting positive child development. But over time, it has really evolved to address all intersecting forms of violence in the family environment, including child sexual violence. Particularly in the year 2021, we have collaborated with Prevention Collaborative and implemented a more gender transformative version of the program, where we have looked at opportunities to deepen the program to address the root causes of violence, and to ensure that families are relating well, families are non-violent, and that we are addressing issues related to harmful gender norms and roles, and addressing power imbalances within the family. This program has been predominantly delivered through group platforms, but increasingly we are expanding those platforms to look at the digital space, but more campaigns also looking at community mobilization efforts, working with religious leaders to use their platforms to deliver and reinforce parenting messages. So yes, it has been a program that we have learned over time, interacting with parents and caregivers, learning from experiences of the group sessions that we've been having, working with government to bring it to scale. And we are happy that in the year 2023, the Kenyan government took it as a national positive program to bring to scale. And now with the potential to really address all forms of violence against children, intimate partner violence, and more specifically, child sexual violence. Thanks, and back to you.
Wonderful. Thank you so much, Beatrice, for sharing that. It's really interesting to see how diverse approaches can converge around a shared goal of keeping children safe. Okay, we're going to move a bit deeper into program design now. And I would like each of our panelists to share, please, any specific components or adaptations in your parenting programs that have helped make them more responsive to preventing child sexual violence. And this time, I'm going to start with you, Joyce.
Yeah, so thanks, Isang. Again, for us, I think almost all those components were actually really important because they're within the pathway to reducing violence. So in my view, as presented from the presentation again my colleague gave, we can see that content around, for example, family budgeting addresses poverty and economic vulnerability, which is a really key aspect when you're talking about adolescents and risk in this setting. So we can say that was really a huge module that was actually required in this setting. There were also some really specific one on teen safety and staying safe modules that offer safety planning, family rules, talking about sensitive topics, and staying safe for adolescents to improve their relationship with their children, especially in particular communication around sexual and reproductive health that is clearly a sensitive topic in this setting. So I think they were all actually playing a role in one way, because they were on that pathway to leading to the reduction of sexual violence, exploitation that adolescents sort of were facing. So clearly, each was playing a huge role in terms of aspects around managing, for example, caregiver stress, as well as teen stress, that within that pathway that leads to the behavior that the teen adopts. So to me, I think all the 12 models were actually really key. They're contributing in different ways. Then those that touch on the actual sexual behavior become even more important when you're now teaching about specific aspects, or when you're wanting caregiver to really communicate those with adolescents. So I think they're all contributing towards that huge thing of, and hence the delivery through a parenting sort of model having made this impact that we see here, that we rarely see in other programs that just target an adolescent in terms of reducing sexual violence. So I think it's that combination set that actually has led to what we've just seen here. Thank you.
Thank you. Thank you, Joyce. Those are really great insights. And Beatrice, I'd love to hear your reflections as well. What components or adjustments have been key in making your programs more responsive to preventing child sexual abuse?
Thank you, Isang, for that question. So there are several components. We initially had 12 modules. So the bigger question was whether to add additional modules that would really reinforce the aspects around sexual abuse. But we decided to look at each of those particular modules and, reformulate them from a gender transformative lens, where people would interrogate the norms, the gender roles, the power imbalances within families across all the modules themselves. So we embarked on that process of looking at each module and seeing the opportunities that we could have in there to be able to reflect on this topic a little bit more deeply than we had initially done. Secondly, again, we looked at the methodology of delivery in terms of interrogating this obviously very sensitive topic. So what kind of activities and actions would the parents and caregivers, look at, reflect on? So role plays, case studies were very critical element of the content of the modules that we, so we had to work with, sometimes real cases and construct them in role plays, in case studies that then would be used as reflection when parents come together in groups to be able to do that. Another bigger element was also to look at how to intentionally include men as caregivers in the whole journey about talking about these things. And that has proved very experienced. From practice, we are seeing, opportunities for both mother and father within the home to sensitively talk about this aspect of sex and sexuality. The other components that we really added, and it was really contentious when we were bringing this program to scale, were talking about sensitive topics around sex and sexuality. And given that within the country, this is a topic that is not easily accepted within our education, curricula, and also within our normal community settings. So we had to work a lot with evidence from the HIV/AIDS, sector to frame these topics in a way that would be accessible, would make sense, would get us the impact that we need, while still not removing it from the modules the way sometimes government wanted us to remove it from there. The other aspect was around conflict management and addressing the norms that really are risk factors towards ensuring girls behave in a certain way and boys behave in a certain way. So we had to interrogate that. So aspects of communication and relationship building, so that we could open a climate within the home where people would, talk about their concerns, their fears, the risks that they encounter, was also very, very important for us. And lastly, recognizing that we are dealing with parents and caregivers from different socioeconomic backgrounds, and some of them are actually children. So parents living with, adolescents with parenting responsibilities, how could we construct a program that would also speak to their needs and aspirations, the challenges and the fears that they need, but also making it very simple and semi-structured to bring back the good aspects that used to happen in our African context and reinforce that with new information from evidence and practice. Yes.
Thank you, Beatrice. I think I can say that the examples that you have shared really bring to life how sensitive topics can be integrated effectively into parenting work. I'm now going to turn to Sangeeta. From your experience, are there particular elements or tools that have worked well in integrating child protection and parenting support?
Yes, yes. So we actually began with sexuality education with middle school and high school, and very quickly we realized that if you're not building the self-esteem, body image of the child or of the parent, then it's not going to work if they're feeling bad about themselves. So we integrated that, and our sessions, our program became a minimum of 6 sessions for children, and of course for parents it is depending on the time they give us. But we cover all the WHO life skills that are well known. And then we also, when we went down to the grade 1 onwards, we do this education. We used locally acceptable language, which is not ambiguous, to refer to the private part. So we made it as per the local cultural acceptability, like susu potty, right? Instead of urine or stools. Things like that, and private parts, or like equivalent, instead of penis or vagina. With English is not the spoken language, and we don't really use the proper words in our native language either. The other one that has worked very well with parents is when we talk about restorative practices, which assume that there is always going to be a power imbalance. There is now no two individuals who wield the same amount of power at all times, at all things. So how do you use power with each other rather than power over each other? And these are value-based practices. So when we bring that in, it is something that rings a bell with the parents, speaking from the heart, listening from the heart, creating a safe space by creating mutually agreed values, and then you share. So those practices are very, very useful. And one thing that has been very useful is explaining that the word sex, it is arising from the word seker, which means division, separate division. And that's why we have female male intersex. But when we but unfortunately the word for the sexual act, it became an adjective. All the organs sexual act was also sex. So now in our minds, when we think of sex, we think of the sexual act rather than as a means of categorizing. And how to remove shame from these parts. We have parenting practices where shame is put in these parts of the child from the age of 2 or 3 or 4. So when we dismantle, so identifying the local cultural factors which are leading to the silence around this, and the shame and the stigma, and then dismantling that, giving them other options. Instead of saying respect your elders, we say respect everybody, respect your child, respect same age people. So there are many aspects of it, but it's culturally relevant. I'll stop there. I know we are short of time.
Yes, thank you so much. These are such great insights, and I'm just excited that this session is being recorded. Finally, let's reflect a bit on what you all have learned along the way. And I'm going to appeal to you to please limit or restrict your answers to just 1 minute so we can see if we can take 1 or 2 questions. So what lessons have you learned or are you learning from integrating child sexual violence prevention into parenting programs? Are there particular challenges, promising practices, or insights that others working in this space could learn from? And this time, I'm going to start with you, Beatrice.
Thank you so much, Isang. One is the appreciation that parents are the first line of protection and defense, and they're beginning to see their role more importantly, because when they understand the risks that are there within their family environments, the next question they ask is, what can we do? So we've seen them gather a lot of courage to talk about the sensitive things within their home, the ability to be more accessible to their children, to ask the right questions, to express their fears. But we are also seeing increased monitoring and supervision of their children. So they are asking, who am I leaving my children with? Where are my children going? What are the early warning signs that I need to watch around? So the demand is there to know more, including what is happening on the online space. So they're increasingly demanding for this information, and therefore the need for us to expand reach and, you know, get to as many parents as possible within the space. The other issue that we are learning is around the challenges that are occasioned by the different definitions of child sexual violence in an environment where social norms are very prevalent. So what constitutes child sexual violence is still not known widely out there. And when we increasingly talk to parents about interpersonal or collective forms of violence, you know, then there is increased awareness to know what to protect and shield their children from. So there are many things they don't understand constitute child sexual violence. So the more we are able to talk to them, that becomes quite important. And then the ability to have a multi-component program. So working within the family is important, but how do you reinforce the new behaviors, the new knowledge, the new protective mechanisms that are there in the family? So working with community leaders, religious leaders to strengthen the community safeguarding and gatekeeping elements around negative gender and social norms become quite important, but also connecting these programs to other programs like economic support that then would address some of the risk factors that allow parents to expose their children to child sexual abuse becomes important. The last thing, we are seeing increased vulnerability of boys. I know data talks about 1 in 7 boys, but we're seeing boys more coming out. So involving boys, in addition to girls more in this program, involving their male caregivers becomes quite important. And as we go to scale, it's about reach, but let's also look at intensity and depth. Sorry, back to you.
Thank you. But I just want to say those are such powerful lessons. Thank you so much. I wish we had more time. I would let you share. Thank you. And Sangeeta, what about you? What are some of the most significant takeaways from your experience?
The most significant, I would say, is that the world is a safe place, safe space, and most people love and care for children and want to keep them safe. What they don't have are the tools, the vocabulary, the means to do that. And it may not seem like that, but even today, the number of people a child comes across online or on the roads or on the way to the school or in the mall or anywhere or even within their family, majority of them care for the child and want to keep them safe. So that has been the learning. And then that everyone, every stakeholder is a product of the society and carries those, notions and prejudices. So there's no villain in the piece. There's no one to blame. We are all a product of the society and together we can change it.
Thank you. And I think it's amazing that we're all learning what works. And as we share the knowledge, parents will be able to step up and be all of us working together can better protect our children. Finally, Joyce, closing out this question, what reflections would you add from your work?
Yeah, so we've learned that actually integration of sexual sort of content in parenting programs requires careful thought on where, in fact, even you embed it within those modules. I think ours has worked very well because we brought it when parents had already learned critical parenting skills that were really important for communication of whatever sexual messaging they needed to communicate with their children. But we've also learned that if you're talking about adolescents, we're talking about here aged 10 to 17, it's really, they also play a role because they're really developing into independence, and they're also having a role in terms of what is communicated and how it's communicated. And when you're using digital approaches like the one we used for the parent app, they come in very handy and they really sort of keep the parent engaged. And we saw the caregiver actually giving the adolescent the phone to go through the sessions that was sort of really a bit difficult for them to start off, and then they would sit together and start having a discussion. So the fact that it was being delivered digitally, it was actually overcoming one barrier of stigma on how best to start off a communication on sexual violence, sexuality and sexual violence in general. But we've also learned that sessions have to be fun. They had a few practical things that they were actually doing outside just the learning, and caregivers and our adolescents were really finding those to be fun to engage with. But we've also learned that actually community mobilization is really key. How you get in with that messaging on sexual violence prevention, on parenting, it's really important that you have the right people on board, they buy it in, and they become sort of the ones on the forefront championing what you're trying to communicate was really important for getting our program to be acceptable. But also co-designing. So as we were trying to actually incorporate a gender transformative sort of aspects so that we can have more male caregivers engaged and impart more skills on how to also have boys included in this sexual violence prevention for boys, we learned that it's really important to understand how they understand violence itself, but also, are they ready? Are the female caregivers that are usually mainly part of these programs willing for males to be involved at the level that sometimes we think that they should be involved? We
Thank
are
you,
really learning
Joyce.
interesting results from that. So it's just
Thank
that.
you.
Thank you.
Thank you. I'm sorry that I have to cut it because we're really doing so well
No
with time, but thank you so much for sharing that. Thank you again, Sangeeta, Joyce, and Beatrice for such thoughtful and inspiring contributions. You've given us a lot to reflect on, from practical program strategies to the deeper shifts needed in how we engage parents and caregivers around child protection.
Thank you.
Lena, do we have time to take one question, or I see we have just 4 minutes left?
Yeah, unfortunately, we do not. But the good news is that most questions have been answered
Amazing.
on yes, and I can see we are getting a response for the final question. So please go into the Q&A and read all the responses that our panelists have kindly given and online. Isang, are you turning it back to me?
Absolutely. Thank you so much. And thank you again to all the panelists and to everyone listening. Thank you, Lena. It's been an honor to moderate this panel. Over to you.
Yeah, thanks to all the speakers and the panelists. It's been such an interesting session. I think everyone agrees. I'm seeing chats, people saying thank you so much to you. They've learned a lot. Someone even said they plan to re-listen because it's worth listening to twice. So that just shows that you've delivered what we created, a very exciteful and inciting session, engaging discussion. So what we've had today is that parenting and support programs are indeed a platform that lies in the heart of child sexual violence prevention. I get asked very many times, really? Not harsh discipline, but we have seen evidence, we've heard from programs, and we've seen how people are truly using this platform to prevent violence in different contexts and in different spaces. So before we close, I'd like to encourage you to use our last few minutes to give us some feedback on this session. It will just make us improve the remaining 6 webinars that are coming forth. Please go to the poll that we've just put to you to just answer 2 questions for us. And yeah, of course, this will help us make this better. Is the poll up? Sorry.
Yes, it is up, but
Okay.
it's not taking any responses, at least for me, because
Now the
maybe
panelists
I'm a
cannot
panelist.
respond.
Yeah.
We can't.
You're not allowed to respond.
Yes. That will be unethical.
Maybe next time. So yeah, so just answer the 2 questions for us and we'll be getting back to you. And meanwhile, we will also put up our final slide, which has a QR code that you can scan, get into our newsletter. I mean, you'll be able to access our website, you'll be able to access a link to sign up for our newsletter. This way you keep updated. If you like this session, there are many more coming. We have one very exciting webinar coming in a few weeks' time in November. And this one we will be talking about practice-based knowledge and launching 2 exciting documents around this. So we are looking forward to seeing you there. There's a QR code. Keep in touch. Thank you again for being part of this exciting first session. We appreciate it and look forward to seeing you in the next one. Have a wonderful day and thanks for coming.
Thanks. Bye.
Bye-bye.
Thank you. Thank you very much.
Thank you. Bye, everyone.
Beatrice, I'll connect with you because I wanted to learn more about involving religious leaders. I've been trying to do that.
Will do.
Yeah.
Looking forward to it.
Yes. Thank you.
Thank you.
Thanks, everyone. It's great to be on this call
Thank
with
you,
you.
everyone. Bye.
Bye, everyone. Thanks for participating.
Thank you. Bye, everyone.
Mm.